As an inguinal hernia, what can happen is the abdominal contents can be pushed through us, basically a sloppy inguinal canal, very loose, and end up down here in the scrotum. Okay, and remember that through the digestive system, the Valsalva maneuver. So oftentimes when you lift heavy things, you do that maneuver without even thinking about it. And typically, when they first recognize this is when they're lifting something heavy. All of a sudden, the contents in the abdominal cavity, abdominal pelvic cavity, are increased with pressure from the Valsalva maneuver, and they go into a lower pressure. If that inguinal canal is loose, it'll squeeze right out into the scrotum. And you would notice that. Dartos muscle, again, that's found within the skin, into the skin of the scrotum. And then finally, cremaster muscle, which is in the spermatic cord itself. Both of them can contract to ascend the testes up closer to the body, but not through the inguinal canal. Okay? They'll maintain the optimal temperature, which is 2 to 3 degrees Celsius below body temperature, in order to make viable sperm. And they can relax to allow the testes to drop farther away from the body, again, to maintain that temperature. There's actually something called the cremasteric reflex, and I told a couple labs about that. And it is a clinical reflex. They'll take like a reflex hammer or thumbnail or something, and they'll drag it along the inner thigh of the guy, and you can literally see the testes go whoop, up. So that's a clinical reflex. Question?
What happened on his waiting
So anyway, there's that. Yeah. Tunica vaginalis is actually an extension of the peritoneum. So the membrane in the abdominal pelvic cavity, it is an extension of the peritoneum. Tunica vaginalis. Remember we cut that off, that little white kind of mushy stuff that was surrounding the testes of the fetal pig? That was tunica vaginalis. It's an extension of the peritoneum, and hence a guy gets kicked or bumped in the gonads. Where does it hurt, guys? In your gut, right? And that's why, because it is literally an extension of the peritoneum, the nervous tissue is. Tunica albugini, I'm not exactly sure how you say that. Albugini, I've heard, but anyway. That is the connective tissue that holds the testes together. The parenchyma, which means the structural unit of the testes, is this thing right here. These little tubules, seminiferous tubules. They're making the baby sperm. Okay? Surrounding them into their little lobes, lobules, is this dense, irregular connective tissue. So if you do get hit in the gonads and are a male, then you can hopefully keep the testes intact. Get hard enough and it literally can rupture. Okay? So just be aware of that. So here we have the seminiferous tubules, this testes, which is actually a connection to the epididymis up here. They're all one continuous tube all the way up to the ductus deferens and vas deferens, all the way to the urethra. Okay? It's all one long continuous tube. But this is really a tough connective tissue. Okay? It takes a lot to rupture the testes. Yeah.
Where exactly in there would a sperm be created?
See this donut right here?
Yeah.
That donut is this yellow tube.
Okay.
We came in, we cut the tube cross-section, and now we're looking, here's that tube right here, magnified 300 plus times. So here's that tube, and here's the lumen of the tube. That's a seminiferous tubule. What's happening is, towards the surface of that tubule, out in this area, sperm are being produced. Okay? They're working their way, growing until finally they get popped out into the lumen. That's the baby sperm. That's happening in the testes itself. And that's what you see happening here. Here's the layer towards the surface, and then it's working its way down. Finally, we have a full baby sperm. Now, they're not swimmers yet. Okay? So there's some help, which we'll talk about, that pulls them along the journey. Ultimately, educate them, throw them up in the epididymis, and then from there, once they exit the male body, that's when they start to swim. Okay? So, but that's a seminiferous tubule up there. You can see there's another donut on the top, another donut on the top. In between those, you see that little purple triangular? Those are interstitial cells. Interstitial cells, I'll be able to make testosterone. Okay? There's a lot of them. In between all these seminiferous tubules, the tube that physically makes the baby sperm is found in interstitial cells. And they make the androgen, the male hormone testosterone. Guys that, those bodybuilders that are really big, huge, they're the real big ones. They're taking steroids. Typically, it's this male androgen called testosterone. And you might have heard that it shrinks the testes. Mm-hmm. And indeed, it does. Okay? And the reason is, if you start giving yourself a shot of testosterone, what do these interstitial cells say? The heck with it. I don't have to do my job anymore. Just like when you're working out, you work out a muscle more, it gets larger, hypertrophies. And if you stop using that muscle, what does it do? Atrophy. The interstitial cells atrophy and the testes get smaller. Okay, so that is true. Anyways, John, did you have a question? Yeah, you simply. Right, no, they have a tail. Good question. The sperm, they don't get the message to swim until they're outside of the male body. Okay? So they have a tail and it's functional, they just don't use it until they exit. Okay? So, yeah, that, just remember, no matter what in the male, they're staying still until they exit. Then they'll start to swim. Okay?
Other than shooting steroids, is there any other condition that's known that can make the
to shrink the testes?
Yeah.
I'm sure there is, but I can't think of one off the top of my head right now. Okay. All right, that's it for today. We'll pick up over there tomorrow. Ball shrinkitis.
Ball shrinkitis. That's a nice one. I don't know. There should be a connection between people who suffer from mumps, like if people.